Itchy, sore, stinging face? Yeah, that isn't normal. Welcome back to my YouTube channel. This is Dr. Eve Skin, and we're going to be bringing you the latest information on skin, skincare, and its interface with medicine. So today we have a very important topic to discuss: rosacea, especially with a focus on how it affects individuals with skin of color. So if you're new here, don't forget to subscribe, hit that notification bell, and you'll never miss any of our skincare tips and tricks. Now let's dive into the topic. Rosacea is a common skin condition that affects millions of people worldwide, and surprisingly, contrary to popular belief, it doesn't discriminate based on skin type or skin color. However, there are some very unique considerations for those with skin of color, and we're going to be exploring some of those in this video. Firstly, what is rosacea? Let's start by understanding what rosacea actually is. Rosacea is a chronic skin condition that primarily affects the facial area, causing classic redness, visible blood vessels, and sometimes bumps and pimples on the skin. It can often be mistaken for other skin conditions such as acne vulgaris, but it's essential to recognize it in order to effectively manage it. Let's delve into the special considerations for people with skin of color. People with rosacea and skin of color may not present with the traditional redness as you expect to see. Often they may describe tingling, burning, or irritation in the middle of their face. And actually, this can be a very good giveaway that they're suffering with rosacea, and something that's really important for clinicians to be able to identify. So if you feel that you've been suffering with this kind of irritation in the middle of your face, there's certainly something that might be underlying it, like rosacea. Remember, sometimes this overlaps with other conditions like menopause, which often trigger rosacea or can coincide alongside rosacea in the 40s and 50s in some women, but often rosacea can be experienced at many decades of life, including in younger years. Rosacea can present differently in individuals with darker skin. Instead of the traditional redness, which is often seen online and in textbooks, you may actually notice darkening of the skin, also known as hyperpigmentation, or greyish patches. Additionally, some people may experience rosacea around the eyes, also known as ocular rosacea, and they may be seen as swollen, warm eyelids, that are persistently red or bloodshot. They may get recurrent conjunctivitis, may have crusty eyelids or eyelashes, or experience things like frequent tearing or a feeling of grittiness like something is in the eye. And some patients also describe burning and stinging in their eyes. Itching and irritated eyes and sensitivity to light can all point to ocular rosacea. The important thing is that without treatment, ocular rosacea can actually affect your eyesight. This makes it very challenging to diagnose, and why it's crucial to consult a skin specialist or a dermatologist for an accurate evaluation, and especially for those with skin of color, one who's experienced with dealing with patients with skin of color. People with rosacea often have different triggers, and they will call these flare-ups. They can vary from person to person and can include things like exercise, sun exposure, hot or spicy foods, alcohol, stress, and certain skincare products. But there are less commonly well-known triggers that also can trigger rosacea, such as things like heat, wind and cold, certain medications, and even fruit. So it's really important to be able to identify and manage these triggers. So let's talk about how we manage these triggers. Managing rosacea is effective and is crucial to prevent its progression, especially as you can develop some more disfiguring side effects from this condition. So here are some of my tips for those who are dealing with rosacea. First, create a gentle skincare routine that focuses on hydration and protection of the skin whilst avoiding harsh ingredients. This is key to keeping the balance in the skin. So avoiding harsh skin stripping ingredients and astringents might mean that toner isn't for you. Also, looking at different medical treatment options can be very, very helpful in managing rosacea. This can include topical creams, oral medications, and even laser therapy. Each of these work in different ways to be able to control the symptoms of things like flushing, the acne breakouts, and even the sensitivity to the skin. Laser and light therapy are more permanent ways to achieve this, but may not be suitable for the darker skin types, so it's important to have an assessment before you consider the treatment. You can explore which of these treatments are much more effective for you with your clinician, and sometimes that might involve a combination of different treatments. Let's talk about lifestyle and prevention. Prevention of rosacea flare-ups is just as important as treating them. Lifestyle adjustments such as changing your diet, alcohol reduction, meditation to reduce stress, and wearing of sunscreen on a daily basis is an effective way to protect and to prevent flare-ups. A sunscreen of an SPF of 30, which is tinted or mineral based, can provide the best form of protection from the sun's ray and reduce the impact of UV light on the skin, therefore reducing flare-ups. You can find ingredients such as zinc oxide or titanium oxide, which form the base for mineral sunscreens traditionally, but newer sunscreens on the market are much better at avoiding that dreaded white cast. You can find some of my favourites for skin of colour on my Instagram page, so don't forget to subscribe there. Thank you all for tuning in today and to learn more about rosacea and its impact on skin of colour. Do remember, if you suspect you have rosacea or you've been diagnosed with it, consult a skin specialist, doctor, or a dermatologist for personalised advice and treatment. Don't forget to like, share, and subscribe for more information and skincare content. Until next time, take care of your beautiful skin.